Opcon-A drops are used to temporarily relieve eye redness, puffiness, itching, and watering that commonly occur with allergies. It contains naphazoline, which is a decongestant that works by temporarily narrowing the blood vessels in the eye, and pheniramine, an antihistamine that works by blocking certain natural substances that cause allergic symptoms. It's important not to use this medication to treat redness and irritation from wearing contact lenses. The recommended dosage is 1 to 2 drops in the affected eyes up to 4 times a day. It's best to use it at the same time every day for the best results. When using Opcon-A drops, it's important to wash your hands first to avoid contamination. Be sure to remove any contact lenses before applying the drops, and wait at least 10 minutes after using the medication before inserting them back in. Check the product visually before using it, and do not use it if the liquid has changed color or is cloudy. Keep this medication away from children and pets. You can use Opcon-A drops in the affected eyes up to 4 times a day as needed or as directed by your doctor. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch, then place 1 drop into the pouch. Close your eyes for 1 to 2 minutes and apply gentle pressure at the corner of the eye near the nose to prevent the medication from draining away. Repeat these steps if your dose is for more than 1 drop and for the other eye if directed. After using the drops, do not rinse the dropper and replace the cap tightly. If you are using another type of eye medication, wait at least 5 minutes before applying it after using Opcon-A drops. Overuse of this medication may result in increased eye redness, so be sure to follow the recommended dosage and not use it for longer than 3 to 4 days at a time. If your condition lasts or gets worse after 72 hours, stop using the medication and seek medical help. If you experience stinging, redness, or blurred vision in your eyes, let your doctor or pharmacist know. Your doctor has determined that the benefits of using Opcon-A drops outweigh the potential side effects. While most people do not experience serious side effects, it's important to contact your doctor if you have any concerning symptoms, such as eye pain, vision problems, or shakiness. Although rare, if you have a severe allergic reaction, seek medical help immediately. If you notice any other effects, be sure to inform your doctor. If you are in the US, you can report any side effects to the FDA. In Canada, you can report to Health Canada. Before using Opcon-A drops, it's important to talk to your doctor or pharmacist if you are allergic to naphazoline or pheniramine, or if you have any other allergies. This product may also contain inactive ingredients that can cause allergic reactions or other problems, so it's best to consult with your pharmacist for more details. If you have diabetes, glaucoma, heart problems, high blood pressure, eye infection or injury, overactive thyroid, or difficulty urinating, make sure to consult your doctor or pharmacist before using this product. After applying Opcon-A drops, your vision may become temporarily blurred, so it's important not to drive, use machinery, or do any activity that requires clear vision until you can do it safely. If you are pregnant, you should only use this medication when clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this drug if you are breastfeeding. It's important to be aware of potential drug interactions when using Opcon-A drops. This includes both prescription and non-prescription medications, as well as any herbal products you may be using. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval to avoid any potential risks or side effects. Always consult with your healthcare professional before making any changes to your medication routine. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. For residents of Canada, you can call a provincial poison control center. Symptoms of an overdose may include drowsiness, decreased body temperature, and slow or shallow breathing. Always be cautious and keep this medication out of reach of children. If you're experiencing symptoms of allergies, it's important to identify and avoid the allergens that may be causing them. Common culprits include pollen, grasses, weeds, dust mites, and pet dander. If your doctor has instructed you to use Opcon-A Drops regularly and you happen to miss a dose, use it as soon as you remember. If it is close to the time of your next dose, then it's best to skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. It's important to store Opcon-A Drops at room temperature and away from light. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed. If the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.